Thanks, Mike. All right, you guys, February is National Pet Dental Health Month. So coming up, we're going to have everything you need to know about keeping your pet's mouth and teeth clean and healthy, plus a furry friend you're going to want to meet after this. Welcome back, everyone. February is Pet Dental Health Month, so just like we need to take care of our teeth, it's just as important that we take care of our pets' teeth too. So joining us now is Dr. Kerry Peterson from Pet Wellness Clinics, as well as Megan, the holder of the very cute pooch. Who is this?
This is Bela.
Bela.
Yes, she's a Cavalier King Charles, so.
She's beautiful.
Thank you.
Is she like the icon of the clinic, or whose dog is she?
She's mine.
Oh, she is.
Yes.
Okay.
Yes.
Very, very sweet. Well, this topic is so fascinating to me because I feel like we all love our dogs, but it seems like when life gets busy, maybe this is the first thing to get brushed to the side. Is that what you're seeing?
Yeah, so about 14% of dog owners, and even less, about 9% of cat owners actually seek veterinary dental care.
Really?
Which is a pretty staggering number. And about 2% of pet owners actually do at-home dental care.
Okay.
So it's something that is so important for multiple reasons, but it just does get forgotten. And so we're here to remind everyone.
Yeah, that's right. And it's probably something that's relatively easy if we stay on top of it.
Absolutely.
But first, let's talk about the signs of if your pet has dental disease.
Yeah. So about 80% of dogs over the age of 3 have some form of periodontal disease.
Oh, wow.
And that could include bad breath, a broken tooth if they start dropping their food, or be slow to go to their food bowl, which is unlike them. You may want to get them to your veterinarian to have a good oral exam. 70% of cats over the age of 3 develop periodontal disease. So
And that seems pretty young, over the age of 3, so it's something to all watch. Dogs don't just have bad breath. That's a sign of something.
Right, and I like to look at teeth as icebergs because the crown themselves is just the tip of the iceberg. So it's below what we can see visually, could be pathologic or have disease processes. That's why it's so important to get them into the veterinarian.
Okay, so if we notice some of those symptoms, we want to bring them in. What are you looking for? What's the exam like? Can you walk us through that process?
So what we would do is, you know, we want to kind of look at their face, look under their eyes because they can get swelling along their muzzle. We want to lift the gums up, and I can lift it up over this side. And we want to look along. We want to look along the gum line for tartar or calculus, redness, bloody gums. That's indicator of periodontal disease. Sometimes we can see tooth fractures. Those are very common in dogs that chew on hard toys, deer antlers, rocks that can cause teeth fractures, and some of those need to be extracted.
Okay, can the dental disease lead to other more serious things?
Absolutely. So over time, that bacteria that's in that plaque and tartar can build up in the bloodstream, and it can cause damage to the heart muscle, the kidneys, the liver. So with very severe periodontal disease, they can have subsequent effects from that as well.
Wow, just like you said, the tip of the iceberg in more ways than one.
Absolutely.
So what's the good news? What can we do to prevent that?
So there's a lot of good things that we can do. I would recommend, if you're going to do at-home care, seek your veterinarian first. We need to get kind of a baseline as to the degree of the tartar buildup, because once it's very heavy, it's very hard to brush it off at home. You need a professional dental scaling under anesthesia. But if you've got a clean set of teeth when they're young, little dental toothbrush, there's finger brushes that are a little bit easier, and you want to use pet-friendly toothbrush or toothpaste. You don't want to use human grade because the fluoride can cause foaming activity that if swallowed, it can cause a GI upset.
How often would we brush?
So I would say 1 to 2 times a week if you can. I would start with your dog and have them taste the toothpaste, get used to it, get used to their finger and the brush in their mouth to start, and then slowly work your way up to brushing. Same with cats. Cats are a little less tolerant than dogs.
Yeah, that's what I always say. Not as friendly, but they need it nonetheless.
Yes, absolutely.
Okay, where can we get more information, and where can we find you?
So we can get more information at petwellnessclinics.com, and Megan's going to go over a little bit of the information about our February dental special.
Yeah, can you tell us real fast?
Absolutely. From February 1st through March 15th, we are running a pet dental special. For our Pet Prime members, it runs $99.95, and for our non-Pet Prime members, it runs $149.95. So if you get an appointment scheduled between that time, we can get you in for those prices.
Okay, thank you ladies so much. Bela, you're adorable. We want to have you back. Mike, such a good reminder. I have a fluffy golden doodle at home. I need to do this. I'm saying right now, I'm guilty. Teeth need to be brushed, and it's happening tonight. Thank you, ladies.
Thank you.